a family practice clinic, and we on average can see probably about 10 patients per day. And I try to do my scheduling a little bit different because I enjoy having time with my patients where I can sit there and get to know them. Part of the problem that we had previously was that so much time was burned up with new patients and completing paperwork that I would lose on average about 4 appointment slots per day. It's pretty diverse. It's, in 18-year-olds up into 90s. I really don't see much for pediatrics, but as you said, I do live in a college town. And one thing that has been really nice that you have helped me out with was figuring out how to do the forms to make sure that we have contact information for these students once they leave the area. What happened previously was that we were losing revenue because we were not able, or actually they weren't the best at completing forwarding information. So you helped with designing the forms. So it was a parameter that they would have to complete. Well, one thing that's really great about it is that there are a lot of features, let me start out with, that we aren't currently using, but we've been in discussion about that. It's great because we can send the forms to the patient via text or email and ask them to complete their forms before they come in. It's also great from the perspective that I can review all of this information prior to their coming into the clinic. So I have a little bit of background information about each of them. As I was saying before, we would schedule 45-minute appointments for our new patients. And it, depending on some of them, how quickly they could work out the paperwork, it could take 20 to 30 minutes on average for them to complete it. And then I would have very limited time with them, which was frustrating from the perspective of not getting a good appointment time with them to go through their background and their concerns. And then also from a financial perspective, because, you worry about the risk of running over on your appointment times. And I'm OCD about making sure that people get into their appointments on time. So that's helped alleviate some of my stress as well. But we're able to keep on time and we're able to add more appointments to the day. Well, I think from the respect, if you think about when a patient is able to come in and get in on time and they're pleased that they actually get to spend 30 to 45 minutes with you when they leave. I've had a lot of people make referrals to the practice based off of those things alone, and knowing that we stay on time. That's a big pet peeve for a lot of patients when they have to wait 20 minutes to get in because their provider is running behind. Something that has been very helpful too that I wanted to touch on. So we have been able to develop packets with your business for new patients and also for established patients that we can send to them. It's really great that they can send us copies of their insurance cards in advance. And for the established patients, it's a great way for us to make sure that all of the information that they have is current. Again, that is something that could be problematic with billing, is when maybe front desk staff forgets to ask, hey, do you have a new insurance card or any updated information? At least I know that we have this backup system here per se that's helpful from that respect. Yeah, it has, because it's, you can click into the files when they come through and get them added into the chart quickly. I know that Athena has some of these types of features integrated, but patients have kind of expressed that sometimes using Athena directly has been a little problematic. So I think that they appreciate this different format that we have. And so every day my staff is looking through what's coming and transferring it over into the program. And then they're also monitoring to make sure um, has a patient actually even looked at the documentation or opened everything. So it's a good way for us to go ahead and resubmit the information to them to make sure everything's timely. It's about the process. And I think overall, if you look at the big picture, they're probably very pleased that they're able to walk right into the clinic and get checked in. I can review their information. I can pull up the forms as I'm sitting there with them and go through their health history and anything that might be pertinent there. But it makes for a much quicker and streamlined process with getting things completed. I love the fact that I see a person walk into the clinic to the front desk, and within seconds they're ready to be checked in because of this. It's been fantastic. It's not even a 5 or 10 minute delay, and then I'm able to take the patient back to the room. There's actual prompts and boxes for patients to complete when they complete the forms through email or even on their phone through the text notification. And I think historically what has happened is when we would provide patients with paperwork, that we would often get incomplete documents. That's one thing that I've been really pleased about, because I feel that a lot of times when you look at adopting any kind of new system, there's a lot of attention initially. And then once you're kind of set in that, that's where some of the problems begin. But I will say consistently, if there's ever been a question that I've had or any concern, I've been able to reach out to someone quickly, whether it would be you or someone actually at the site, because there's also that chat feature and people respond very quickly, and you can get the help right away. Everybody has always been very professional and helpful, and it's if there's been any kind of concern, it's acted upon quickly. It's not sitting in a queue for weeks. Well, I have not ever tried out something like your program in the past. And I will say one thing that I like about it is that it's very affordable as a single practice owner. And a lot of there are a variety of different programs out there that you have to really nitpick and search through. A lot of them are very, very expensive, but that's one thing that I absolutely love about this, is that it's reasonably priced and good quality, great quality too. So I haven't even opted to look at other programs because I've been very pleased with what I have right now. Great customer service and communication, great price, great program, very time efficient. And as I said, it takes away some of my personal stress because I get really anxious about staying on time. And I've been able to stay on time, which translates, like I said, into increased revenue. And then within Athena, there's a quality measure and survey that gets sent to patients. And of course, one of the biggest pet peeves that patients always have is the timeliness of appointments. So I'm sure that that has impacted my quality score as well. And I have actually shared some information about this in one of the groups that I'm in on Facebook, about how easy it is to work with you guys to develop the forms the way you want them. I know that your primary focus has been dentistry and you guys are expanding, but I really appreciated that I could send the forms, have a conversation with you about what are the important things that I need, and that was completed. I also let them know from the financial perspective that you can actually add more revenue because you're able to stay on task time-wise and add those additional appointments. So yeah, I try to share as much as I can. When I see comments on Facebook, I try to comment as well there too. My big thing is I try to tell people, hey, this is not just dentistry now. It's, you can use it in primary care as well.